Right now, we think it's our leading health problem that we have within the fire service, cancer. It is at an epidemic rate right now. We are seeing more firefighters die from cancer than anything else in the fire service. So for us, our primary role there, health and safety, is to try to reduce that. How do we reduce that? There's a number of ways, and we're trying to tackle each way that we can address it, from the organization, all the way to the members, from the labor and management agreements, all the way down to the researchers. What are the researchers doing? How are they helping us? How are they supplying the information we need? So we can convince our members that this is a real problem. This is not something that's going to go away, and until we do something about it, we are going to continue to see the rise of cancer in the fire service. I mean, there's things we can't control. Those are things that are the dangers of the job. It's when you sign up, become a firefighter, there's risk. But there are things that you can control, and those are the ones that we want to focus primarily on now. And one of them is even with lifestyle, even with what we're not addressing some of those issues of nutrition, education, training, prevention. All of those things kind of wrapped in together are something that every individual firefighter should understand and know before they even come to the job, before they have to know what those risks are. Our big goal too is the organization. I mean, how is the organization taking care of the members that are protecting the communities around the country? What are they doing? And they are responsible for the health and welfare of these members. Are they putting these programs? Are they embedding these programs? Do the members understand that there's not an option here? When you go and fight a fire and you're in overhaul, you don't take your SCBA out. There's nothing we know that can substitute that. And that is a needless exposure that doesn't have to happen anymore. When you're at the firehouse, bringing your turnout gear into the bunk rooms, not having 2 sets of turnout gear, not decontaminating. The most contaminated part of a firefighter's, I think, tools or apparatus is that inside of that cab. It probably has more particulate from fires, and we don't clean those out. We don't think it's going to happen to us, and that's the problem. So leadership, I think, is a huge role in cancer, associated with education, training, making sure they understand, and then the research to help us reinforce why those dangers exist, and these are the real areas that they exist in. I want to keep it simple to the fire service, to let them know that I haven't met one firefighter that was dying from cancer that said I wanted more exposures. I've met so many firefighters that have died from cancer and said I should have done something earlier. We have an opportunity to do that. It's our obligation to do that, and I hope we find the leadership out there willing to take this on.